Hello, I'm Molly Deutschbein. I am a licensed massage therapist, a craniosacral therapist, a doula, and I specialize in infant body work for breastfeeding and lots of other things too, torticollis, digestive problems, etc. But the focus of this talk is on craniosacral therapy, fascial body work for the breastfeeding family. So, who am I to talk about this? Well, I started teaching childbirth classes more than 30 years ago. I was also a LeLeche League leaders, which meant that I was a peer counselor for breastfeeding. And so I have helped hundreds, probably thousands, yes, thousands of families through fertility challenge, childbirth, postpartum period, and feeding difficulties. I'm also a certified craniosacral therapist through the Upledger Institute, and I'm also a registered craniosacral therapist through the Biodynamic Therapy Association for North America. I'm one of the founding members of the Abdominal Therapy Collective. I'm a Spinning Babies approved provider. I'm an approved continuing education provider for the National Certifying Body of Massage Therapists. I've been working with babies for a long time, and I've been doing this work with families for a long time. And so I just want to share with you what makes craniosacral therapy, fascia therapy, body work helpful to the breastfeeding process, and also point out how it's different from other kinds of body work and how we all work together. So when we're talking about the breastfeeding dyad, the infant, and the breastfeeding parent, we talk about treating the whole family. We're not just treating the baby, and we're not just treating the mother or the breastfeeding parent. And so it takes a lot of time, and we want to be really sensitive to this particular time in life, which is delicate and prone to people saying negative things or being unsupportive. So we want to create an environment in which the family feels very supportive, where they can talk honestly about how things are going for them. And so my visits with them are long. The first visit is at least an hour, and the subsequent visits after that are at least half an hour. They often run to 45 minutes or more. I'm trying to create an environment in which I'm giving a therapeutic presence to both the baby and the extended family that might be there. So it might be just the breastfeeding parent, or it could be both parents. It could be grandparents. It could be the nanny. It could be other siblings. Certainly prior to COVID, I used to joke that babies had entourages. And so we're holding a space in which the central nervous system of the baby and the breastfeeding parent can have their nervous systems co-regulated, soothed, calmed down, so that we can actually do some body work with the body of the baby in a receptive mode, where it's going to be working with me on those changes. So in that appointment, especially the first one, we talk thoroughly about the parent's pregnancy, how they felt, different things that baby might have been doing or not doing, moving around in the womb, how the birth went, the immediate postpartum period as they were recovering. And then we also talk about what they've noticed with feeding and baby's mouth, a whole bunch of other things. Sometimes there's some emotional processing that goes on with that too. And I am looking at the baby and making observations about how the baby is moving, how they're holding their heads, how their jaw is feeling. So I'm doing a lot understanding the baby's whole body, but then I also put a glove on my hand and I do a very detailed assessment of what's going on inside baby's mouth, the shape of the palate, the hard palate, and everything that's going on with the tongue and the floor of the mouth from inside of the mouth, but also here, the hyoid bone. I'm looking at how both of the TMJs are functioning. And I'm particularly interested in the base of the baby's head and whether the baby's head is an extension or not. Often these babies with very tight heads, they hold them up really well, but it causes other problems. We get baby into a tummy time position and see how baby does with that. And we do a lot of positional release where we're not necessarily trying intentionally to stretch things, but giving the body the opportunity to move into contracted poses where the muscles will spontaneously allow themselves to find a new way of being. So that's how I approach the appointments. We are very fortunate in Rochester to have a wonderful set of practitioners who enjoy collaborating, and it is my professional belief that the ideal situation is that if baby is having breastfeeding problems or just feeding problems, because babies with oral issues may not be feeding well at the bottle either, and they need those things addressed. The lactation specialist, the IBCLC or feeding therapist, is the one who really assesses the baby and refers them on to the next steps. Body work used to be the main thing that we had before we had lasers, because if the baby's release needed to be done with something other than scissors, the baby was over a certain age, body work was all we had. So one leg of the three-legged stool is the lactation consultant. Another leg is the body worker. And then the third is the release provider, whether they're using scissors or they're using a laser. And all three of those legs of the stool are treating the family. We're not just treating a baby. We're not just treating mom. Excuse me. We're treating the family. That's why it's so important for someone like me who's working on the bodies of these babies to really be thinking about therapeutic presence and co-regulation of the central nervous system. It's not enough for people to know the techniques for working with babies, in my opinion. I believe that if you're going to do the kind of work that I'm doing, where you're working with the soft tissues and you're in babies' mouths and you're talking about really sensitive things with parents, knowing how to be with them in a way that isn't going to cause more harm is really, really important. So I've had lots of extra training in infant mental health. It's not saying I'm an expert, and I'm not a talk therapist, but I respect that the baby is a person having their own psychological experience. The parent is a person having their own psychological experience. And then we've got this whole family unit that's having an experience. And within that, we apply principles of therapeutic presence and co-regulation. Those are new buzzwords that have come out in the past, 10 to 15 years that simply mean that I am modeling for the family how to be calm and centered as I'm handling their baby, as I've got my face right up in a woman, so the breastfeeding parent is sitting here next to me, she's holding her baby, and I've got my face right next to baby's face, looking at what baby's tongue is doing through the chin, and maybe taking my gloved hand and seeing, okay, so can I get that upper lip to stretch a little bit, to soften, so that baby has more motion, more flanging with their lips. So I need to be in a calm and centered place as I'm doing all these extra techniques that I know how to do. So what makes me an expert on something like craniosacral therapy? Well, I've been doing this for a long time. I've been teaching for different organizations and myself for a number of years. This is just a partial list of some of the trainings that I have done. So I feel like I understand this thing called craniosacral therapy, which is really a subtle manipulation of fascia in the body, the whole fascial system, especially the fascia as it relates to the central nervous system, and helping the body to come into a calmer, more regulated autonomic nervous system situation. I feel like I know a few things about that. And I feel really comfortable working with families and educating them on how they can help their babies and what they can do to help co-regulate with their babies. So, what makes my kind of therapy different from a different kind of therapist? Well, that therapeutic presence thing that I was talking about is all about finding some stillness. When the body has the ability to quiet, then it can enlist its own homeostatic resources to create change. When the central nervous system is in a non activated, safe feeling place, then it has the resources to create more healthful patterns in the body, to let some muscles relax and find a different pattern and let others experiment with being strong. So Stephen Porges, whose research started with oxytocin, which is the bonding hormone, he put some wonderful words to this in what he calls his polyvagal theory. And basically, we're always running this program where we're assessing the environment for safe, non-safe. So as our body is monitoring the environment, now there's nothing conscious about this. This is all stuff that's just kind of running in the background. We can't influence it with our thoughts. The body's assessing safe, not safe with this process that he calls neuroception. If we're feeling relatively safe, then we are able to spontaneously engage with others, and our body's ability to heal, digest our food, move through our day, we're regulated in a good way. If the body senses danger or we're uncomfortable, we're aware, we're alert, we're what we call activated, then we are engaging defensive strategies like fight or flight. We're ready, we contract everything here, we contract our hips, our psoas, our hip flexors, and we're in a crouched, ready to go mode. It makes it very hard to digest. Babies that are super tight and stiff, often they will also have their heads at extension. They have a hard time digesting food. The whole peristaltic system is very difficult for them because they can't regulate back into a place of safety. And then if there's a stressor that's activating the body that is so strong that we feel that our life is in danger, then we put some defensive strategies into effect, which are effectively a freeze. And with babies, they don't have a lot of options for fight or flight, so they can go into a freeze state, which makes them have other issues where maybe their tone doesn't seem very good, or their digestive tract moves too quickly. They have a hard time getting roused to breastfeed. They're just not as social. Like their faces may not be moving as well. These are the babies that I worry about the most because they're not fighting. They're not exhibiting a lot of grit. They're kind of giving up, right? So I am watching the babies and the parents to see which of these states that they're in, hopefully so that we can get them into a more regulated place and allow, like I said, allow the body to do the healing for us, particularly in the baby. Craniosacral therapy, craniosacral is just a weird word. Dr. Upledger was an osteopath, and he came up with the idea that it would be a good idea to have some of these osteopathic techniques in the hands of people like me. We didn't have to be fully trained osteopaths in order to do these very gentle, non-directive manipulations. And biodynamic craniosacral therapy, the other thing that I'm certified in, is even more non-directive, super passive on the part of the therapist, really just keying into what are the natural movements and forms that this body fascia wants to make so that we can help it move into a more functional place. It's a very gentle hands-on method of evaluating and enhancing the functioning of fascial planes in the body and a physiological body system called the craniosacral system, which is everything from the head to the sacrum with all of the central nervous stuff in between. And the key here is soft touch, subtle touch. And in my career as a manual therapist focusing on craniosacral therapy, all of a sudden there's this new field of fascia, which describes what this work has always been. You need soft, soft touch to get into this network of membranes that's all throughout the body. And a tight fascial system will keep muscles tightly engaged even when the muscle fibers themselves are still nice and stretchy. So we want to, the way I put it is, I help people relax from the inside out, from the central nervous system, giving the body a broadcast that it's okay to let go and soften up now. So some things that are different between someone who's practicing regular massage therapist and someone who specializes in craniosacral or fascial therapy like me. Like I said, I specialize in something that helps the central nervous system soothe. So the central nervous system says to the muscles, hey, it's time to relax now. A regular massage therapist, and there's nothing wrong with them. Massage is wonderful, and there are times when it's really, really helpful to do very direct orthopedic massage and things that are really bossing the body around, because that's what's needed to get the body to the next place. I refer babies to physical therapists for that kind of direct work all the time. But for me, what I'm doing with fascial therapy is creating that sense of safety so that the baby's body is in charge and the baby's body can show me the movements that it naturally wants to do, and we can help it come into better movements using homeostasis. We're using super, super light pressure, and we're treating the fascial sheaths of all the cranial nerves, and those cranial nerves, particularly 9, 10, 11, and 12, are really important for tongue movement, swallowing, fight or flight, suck, swallow, breathe. We want all of those last 4 cranial nerves working well so that everything here is working well. And I work on the fascial sheaths of those nerves. The other thing that I do is I'm able to get inside the brain to the connective tissue that's supporting the brain. And I think I've got a picture of that here coming along. Often people ask me, what is the difference between chiropractic and craniosacral therapy? And my chiropractor friends, please don't be mad at me for overgeneralizing. The fact is there's a ton of ways that we intersect. Often, due to ignorance in the general public, people are afraid of one or the other of us. They don't understand what craniosacral therapy is. They think it's witchcraft or energy medicine, which it is not. And so they'd rather go to the chiropractor. And some people are afraid that the chiropractor is going to be too rough with their baby. They've never seen chiropractic done on infants, and so they'd rather take a chance with craniosacral therapy first. The fact is, chiropractors are super gentle with babies. Watching a chiropractic treatment is beautiful. I work all the time with local chiropractors, referring back and forth. I have geographic, I'm so lucky. I've got chiropractors in every geography where I feel really comfortable sending the families that I work with. Their work is really, really important, especially if we need to get very direct about the alignment of the spine and the bones, the jaw. I can't be as direct with their work, and so they can be more efficient than I can because I can't adjust a joint and they can. That's in their scope of practice. So they also get settling of the central nervous system because that's what they're doing. They're trying to get all of the parts of the central nervous system all along the spine, the bones of the head, lined up well so that everything's moving with as much efficiency as possible. There are some chiropractors who think that they are allowed to work in the mouth and other chiropractors who think that they aren't. I'd let the chiropractors sort that out. But I know that I am allowed to work inside the mouth. I've had lots of training on working specifically in the mouths of infants as well as adults. So every baby that I see gets my finger in their mouth, I ask their permission. I'm very slow with it. If they don't want my finger in there, I don't do it. But that way I can do that intraoral work to soften everything through here and work with the shape of their palate, which often with breastfeeding infants with feeding infants who are having problems, that palate shape is a big part of what's going on. And so I'm working very subtly with all of the fascia in the body, trying to settle the nervous system, keep all the fluids moving, and hopefully bringing the baby into a better regulated state so that they're sleeping better, pooping better, and generally being able to use their little social nervous system so that they can smile and coo and be involved with their caregivers in such a way that their caregivers are happy about caring for them. Super important piece of the work that we do. So here are those pictures that I was saying I would be able to show you. These are the fascial planes that some people see in the book Anatomy Trains as written out, as drawn out for babies. So we work the babies literally from their feet all the way to the top of their heads, and we want to be sure that there aren't any tight spots that are impeding baby's digestion, the peristaltic movement of food through the belly, and all of this. We want to make sure the tongue is moving really well. We want to make sure that all the connective tissue that's inside the brain, it doesn't have weird torques on it, because that's what gives us some head shape stuff that's really interesting. So when I'm working with the fascia of the infant body, these are the planes. These are just 3 of the planes. There's an infinite number of planes because there's tons of fascia all over everywhere. Take a look at these beautiful structures here in a baby. So the first bones to fully ossify are the hyoid, the mandible, and the clavicles, because that's the anchor for the whole suck, swallow, breathe milieu, I guess we would say. And so all of that needs to be super secure so baby can feed after birth. Baby's got to get more food so the baby can grow, right? This is a survival piece. Important things, just points of interest. The omohyoid is a hyoid muscle that goes from the hyoid to the clavicle and then back to the scapula. So we think of torticollis as being mainly the trap or the sternocleidomastoid muscle, but it can also be the levator scap in the back or the omohyoid. Those muscles, if they are tight, they're little itty bitty teeny weeny muscles in babies. They can cause a lot of havoc. So those are things that I'm looking for all the time. There are 16 muscles attached to the hyoid into the bottom, the floor of the mouth and the tongue, and also down to the scapula and the thyroid cartilage. And we've got retro ones that come off of the head, like the styloid process of the mastoid, the styloid process next to the mastoid process on the temporal bone. So there are all these places that tension can be pulling the hyoid bone over in this direction or that direction and causing asymmetries in the mouth and how the tongue is moving, so that baby suck is not symmetrical. If baby suck is not symmetrical and even, that's going to cause problems with mama's breast. The parent's breast is not going to be equally emptying. It might be pulling more from one side or another. It might be causing her pain on her nipple. So these are all important structures for me to be looking at to help the breastfeeding parent be more comfortable and the baby be more efficient with feeding. If babies are very good at conserving energy, they are going to find the least energy expensive way to do what they need to do. And if that means doing everything in a lopsided way, they're going to do it. So I want to make it worth their time to do it as symmetrically as possible. And you just want to remember, the hyoid bone is not attached to any other bone. It's a very small bone. And we use almost no pressure when we're touching the hyoid. This work is so gentle, so gentle. The other thing that's different about craniosacral therapy, and specific, the thing that's called that, is that we treat what we find instead of doing differential diagnosis. So I greet the baby with an attitude of, you're going to show me with your body what you need, and I'm going to follow your lead. And then we use differential diagnosis and assessment to double check what we have found. So we're coming at it from the opposite direction, feeling what the fascia wants to do, and then looking at our knowledge of anatomy and physiology and the function of all of these things, and making sure that what the body is showing us and what we think should be happening are going together. And what's really wonderful about that is sometimes they don't. And so that means there's a mystery, there's a piece of the puzzle that we're not seeing. And we want to be sure that we get to all those pieces. So I can actually sometimes bring, especially since I'm a birth worker, sometimes when we get together and we talk about, as a collaborative, the infant feeding collaborative, we talk about cases. I'm the one who's throwing in these weird things from, well, when she was carrying the baby, this was going on, or as the baby was being born, do you think it could have something to do with that? It's so wonderful to have all these people talking from different perspectives. And I'm always curious when there's something different to be explored. So mouthwork in the newborn is, very, very gentle, always wearing a glove. And when, of course, COVID times, I'm still wearing a mask because I'm protecting them from me and me from them. I don't know. We'll talk more about that in a minute. Anyway, so we're doing proprioceptive massage around the face, the cheeks, the gums, assessing the palate, like I said before, doing a tongue assessment, and doing what I can in terms of fascial release to make the tongue as free as possible. Even if it has severe restriction, sometimes we can make a huge difference just by working in there. The release of the muscles, mastication, the chewing muscles, the 4 sets of muscles on either side that help us, 3 sets to close and 1 set to open. And then the orbicularis release, making sure that everything around the mouth is nice and soft. Often here there might be a lip tie, but this muscle can be super tight whether a lip tie is there or not. And even if a lip tie is released, we want to make sure that this gets soft, because just because it was released from underneath doesn't mean that the muscle's going to spread and soften. So I actually give parents some techniques to use themselves. They aren't even massages, just helping those fibers to soften and release. So I just wanted to finish by showing you some images of babies feeding. This is a great animation. The YouTube link is up on the slide there. There is, so here's my little pointer right here. That little muscle that helps coordinate the closing of the back of the mouth. This one is really super important. And you see how in the next piece, slide copy of that I got here, it has to raise up so that the breast milk can go down the back of the throat. This is another great clip here of someone talking and swallowing, and you can watch all of these muscles that we don't talk about, and I can't touch. I can't put my finger in past there because then the babies are going to gag, right? So this is why being able to work indirectly as a fascial therapist, I can get to all the things deep in there. It takes patience, it takes time, it's very subtle work, but we can do it. So it's not just touching what's on the surface, it's touching what's on the surface in such a way that we can get to the really deep parts. And like I said, freeing up those fascial sheaths of the cranial nerves that control those muscles so that we know that their signals are going back and forth to the brain with their fullest capacity. So that just gives you a sense of the work that I do as a craniosacral therapist, fascial therapist, infant body worker, how I work with the other people that are part of my team. We are so, like I said, so fortunate in Rochester to have wonderful international board certified lactation consultants. We have our own breastfeeding medicine clinic here at the University of Rochester. We have IBCLCs who do home visits, who are independent. And then we have at least two great craniosacral therapists, me and another person in town, Karen Qureshi, and then we have a whole handful of wonderful chiropractors that we work with too. And then now we're really super lucky because we have, instead of telling people that they have to drive hours away, we have two laser providers in Rochester who can do laser releases on babies and adults right here in our own city. So we've got a great collaborative team in the hospitals, in clinics, and people like me working in their own little office, providing these babies, these families, these breastfeeding diettes with the support that they need so that we know that baby is getting fed and growing and you can enjoy them. That's the point of a baby, is to enjoy the baby. So let's get the feeding right so the enjoyment can begin. Anyway, thank you so much. Give me a call, send me an email if you have any questions.